Welcome everyone to the 2020 version of the Trottier Public Science Symposium. And it certainly is not the same as we've had over the last decade or so. Instead of being in a beautiful auditorium surrounded by hundreds of people, here I am surrounded by my ducks. But thanks to the technology that we have available to us, we will certainly be able to make sure that you get all of the information. And in fact, visually, it will be perfect because you are right there looking at the screen, closer than you would be in the auditorium. Well, before we get going, I would like to call on our Principal and Vice Chancellor, Suzanne Fortier, to welcome all of you from wherever you are looking on in the world.
Merci, Dr. Schwartz. Bonjour à vous tous et bienvenue à ce symposium. Welcome to this great Trottier Public Science Symposium, and thank you for joining us. You know, this symposium is a very popular and extremely well-attended event at McGill every fall. It's become a fall tradition. As you know, maybe it is hosted by the McGill Office for Science and Society and made possible by the Trottier Family Foundation. And I'd like to take this opportunity to thank the Family Foundation, the Trottier Family Foundation, especially Lorne and Louise, for supporting this great series of symposia. L'objectif est de partager la science, les informations scientifiques avec un grand public, mais aussi, et ça c'est très important, de promouvoir le sens critique. Over the years, the Trottier Symposium has covered a very large and very interesting set of topics: nutrition, vaccines, and last year's very popular series on longing for longevity. This year's speakers will address the question, in whom do we trust? And of course, we all know how important this question has been, particularly this year. It's in all our minds with the pandemic, in whom do we trust? But of course, the question is asked in all areas, whether politics, healthcare, journalism, or the environment. I would like to thank today's speakers, Brendan Nyhan and Britt Hermes. They're joining us remotely from Germany and from the US, and we very much look forward to your presentation. So merci beaucoup d'être ici avec nous, et je passe la parole au Dr. Schwartz.
Trottier, and welcome back again. The Office for Science and Society at McGill was founded 21 years ago through a generous donation from Lorne Trottier, and our mission is to separate sense from nonsense, fact from myth. And you can imagine how challenging that is. Our world is changing. It is different from what it used to be. And certainly the question comes up, in whom do we trust? We used to look at our world as beautiful blue globe as seen from space. Today, it has been taken over by the coronavirus. It is set to basically explode our life. And there's something else that is going on now. There's an explosion of information. Unfortunately, also of misinformation and disinformation. And this is a challenge. Now, of course, some of this information is totally superfluous. We can easily do without it. Some of it is just absolute nonsense. But we also are privy to the world's scientific literature. It is there at our fingertips, thanks to the technology that we have available to us. You know, it used to be pretty easy to distinguish between sense and nonsense. We would look at the tabloids and immediately would know this is nonsense and pass it off. But things have changed. Today, we look at our laptop, We see doctors standing in Washington in front of Congress talking about the benefits of hydroxychloroquine. Now, this is a very select group of doctors who call themselves America's frontline doctors. It's a fringe organization, and they believe that hydroxychloroquine is the cure for COVID-19. Whereas, of course, science tells us that this is certainly not the case. But not everyone can distinguish whether or not this is sensible or not. And then we have promoters of QAnon, which is a rather bizarre movement, claiming that there's some sort of conspiracy, a cabal of pedophiles who torture and butcher children, led by people like Hillary Clinton and former President Obama, so that they can remove their blood and isolate from it adrenochrome, a chemical that is going to make them younger. It is really quite unbelievable what people will believe these days. So it is more critical than ever to determine whether or not news is real or whether that news is fake. Hard to tell. Do you remember when the US landed astronauts on the moon? Do you remember what happened? They crashed onto the moon. And President Nixon told us exactly what happened. Let's have a look.
These brave men, Neil Armstrong and Edwin Aldrin, know that there's no hope for their recovery. They also know that there is hope for mankind in their sacrifice. They will be mourned by a Mother Earth that dared send 2 of her sons into the unknown.
That video, of course, was a big fake. It was put together by scientists at MIT, and it's really quite remarkable what you can do. We used to say that you should not believe anything except what you see, witness for yourself. We know now that this is not true. Let me give you another example. Would you like to meet this guy? Or perhaps this lady? Or perhaps this child? Well, you would have a hard time doing that because they don't exist. They are all computer fabrications, but they look amazingly real. So we can no longer trust our eyes either. That's why we have to make sure that we know what is fake, and we have to be able to replace it with real news. But how do we know what is real? How do we know whom to believe? There are people yelling at us, screaming at us, all sorts of information. So this is the opportune time to really ask the question, in whom do we trust? And today our 2 speakers will address this very question. So let me introduce you to Britt Hermes first. Britt was a graduate of Bastyr University, a naturopathic college in the US. And then for several years, she practiced as a naturopathic physician. And then she became disenchanted when the gentleman that she was working for started to prescribe some very, very questionable cancer treatments. And this led her on a totally different path. She has left naturopathy and she has taken a turn towards real science. Now she's pursuing a PhD in Germany, which is where she joins us from, where she is investigating the microbiome, which of course is that collage of bacteria that live inside of us. And she's going to study just how external bacteria affect our internal bacteria. This is real science. So I will now call upon Britt to come over from Germany and tell us about her transition from being a naturopathic physician to a true scientist.
Hello, everyone. I'm so excited to be here. Thank you so much for having me. So as Joe mentioned, I am a PhD student in evolutionary genomics, and specifically I study the skin microbiome, the tiny organisms that live on all of us. This is the reinvented scientific version of me. I'm not here today to talk about this version of me or this research, but rather I'm here today to talk about who I used to be. Meet Dr. Britt, naturopathic doctor. From 2011 to 2014, I was a licensed naturopath in the US. And thanks to funny legislation, I was a doctor licensed in the state of Washington and Arizona, which meant I could bill insurance, I could write prescriptions, I wore this nice white coat, I had a stethoscope around my neck, and I was allowed to call myself a primary care doctor. My elevator pitch went something like this. I combine nutrition and lifestyle advice with cutting edge natural and pharmaceutical medicines to provide the most effective and affordable care. Naturopathic medicine is the solution to America's healthcare crisis. So, yeah, I was drinking the Kool-Aid. I likely would have gone the entirety of my career as a naturopath if I hadn't unexpectedly found myself in a nerve-rattling situation that led to me leaving naturopathy, becoming a naturopathic whistleblower, and the most hated naturopath in the world. I will tell you that story. But first, I want to tell you what naturopathy is and how I got there. Naturopathy is based on magic. Its origins trace back to the late 19th century belief in vitalism. In this sense, all living beings embody a sort of supernatural energy force that is responsible for making you healthy or sick. The point of naturopathy is to manipulate this energy with natural stuff like water, plants, sunshine, and just generally through interacting with nature. Other traditional systems of medicine have similar concepts. So it's called qi in traditional Chinese medicine, and Ayurveda calls it prana. I came to naturopathy when I was 16, after I was diagnosed with psoriasis. I have a vivid memory of going to the dermatologist, upset because I had these large red plaques all over my body, and crying, wanting to understand what was happening, why I suddenly seemingly developed psoriasis, and what I could do about it. He told me that essentially I was going to have psoriasis for the rest of my life. I needed to just suck it up, and I was going to be on steroid treatments probably for the rest of my life. Instead of accepting his prognosis, I got sucked into the world of natural medicines. I started taking all kinds of supplements, antioxidants, fish oils, what have you. I significantly changed my diet and started eating clean. And I got better. But when I was telling this story later on, I would conveniently forget that at this time, I was also using topical steroid treatments and prescription shampoos. I wasn't a really strong critical thinker. But I used the psoriasis story in my application when applying to naturopathic programs years later. In my personal statement, I wrote, in naturopathic medicine, the oath to do no harm is more significant and prevalent than any other field. Medical physicians lack training to find the root cause of disease. Their treatments suppress the symptoms of a greater underlying issue, which causes the patient to get sicker over time. This suppression is the worst harm a doctor can impose on a patient. I think you all will not be surprised to learn that I was accepted to every naturopathic school to which I applied. And in 2007, I started naturopathic school at Bastyr University in Seattle, which describes itself as offering degrees in science-based natural medicine and as a leader in cutting-edge research in complementary and alternative medicine. I fully believed I was in medical school. Naturopathic students are consistently being told that they are engaged in a rigorous curriculum, comprehensive clinical training, and groundbreaking research. In reality, naturopathic schools peddle pseudoscience. Naturopathic schools are unique in that they teach naturopathy plus just enough real medicine to make it all seem legitimate to the unsuspecting. So for example, we had a gross anatomy lab. I took a biochemistry course, I took a physiology course, among other classes with medical titles. But I believe that BS outweighed whatever real science was taught in the program. Naturopathy is seemingly comprised of any type of alternative medicine that you can imagine. So a favorite magical treatment among NDs is homeopathy. This is a debunked therapy from the 18th century that involves giving patients incredibly extreme dilutions of things like herbs, metals, poisons, or even the bizarre like the Berlin Wall that supposedly cause symptoms of the disease being treated. Homeopathic remedies are so diluted that none of the original substance remains in the product. Rather, it is the so-called water memory of the remedy that is believed to treat the disease. And NDs don't see homeopathy as nonsensical. I was required to take 3 times as many classes in homeopathy than pharmacology. I was required to learn about traditional Chinese medicine, energy healing, hydrotherapy. I was consistently exposed to magical thinking, like medical astrology, on numerous occasions. For example, this 2013 class, Plants and Planets, an Astrological System of Medicine, was taught by the Director of Research Laboratories at Bastyr, who describes himself as an always learning herbalist and laboring alchemist. But even outside of these woo-woo courses, integrated into almost every so-called real medical class I took were worrisome examples of pseudoscience. Here's a snapshot from my pediatrics course that taught us to use homeopathic remedies for acute medical problems in children. One of the things we were taught was to use belladonna for treating febrile seizures. Belladonna, which is commonly known as deadly nightshade, is a very poisonous plant. In 2017, homeopathic teething products contaminated with dangerously high levels of belladonna caused deaths. And this pediatrics course was just riddled with anti-vaccine thinking. We read the Bob Sears Alternative Vaccine book, which outlines delayed and limited vaccine schedules. We were taught to doubt the scientific consensus, health authorities, and vaccine research. And if you can believe it, it gets worse. We were also taught naturopaths could treat mental illness. Here are some of my notes for treating schizophrenia. I was taught food allergies might cause hallucinations or delusions, and heavy metals. This refers to testing for heavy metals. Which ones? All of them. Why not? It doesn't really matter. They sound scary, and a patient sitting in a naturopath's office is very likely to go along with any recommendation being made to them. But there's no reason to think that heavy metals cause schizophrenia, or even that the average person has been exposed to dangerously high levels of them. And when I'm taking in all of this information, I'm not thinking this is crazy, because remember, I believed that I had cured my own psoriasis with diet changes and supplements. Instead, I'm thinking, medical doctors are so stupid. I bet they don't even test schizophrenic patients for food allergies or heavy metals. I think you get the picture. Naturopaths take some classes with the same names as medical school courses, but the content that naturopaths learn is alternative medicine. And this is what all the naturopathic students are into. Naturopaths mostly all think that they are the future of medicine, and they are motivated and organized enough that there are even international trips to get medical experience treating patients in developing countries. After my second year at Bastyr, I went on one of these trips to Ghana. Before the trip, I had only taken a weekend course, 2 days, a weekend course on giving intravenous injections. With that experience and no supervision, I was allowed to give intravenous injections on very sick patients and some severely dehydrated children and others with unknown infections. We were not allowed to diagnose, but we treated patients anyway. Looking back, this is absolutely horrifying. Today, naturopathy has been rebranded as naturopathic medicine. Naturopaths call themselves naturopathic doctors, or NDs for short. And the profession has been somewhat successful at passing itself off as a credible medical specialty that claims to blend the best of both modern and traditional medicines. And to get here, naturopaths have aggressively and relentlessly lobbied for laws to allow them to be licensed. I know because I participated in this licensing effort. In my last year at Bastyr, I attended an annual lobbying event called DC Fly. This is where naturopaths across the US gather in Washington, DC to lobby for recognition as a legitimate medical profession. And under the direction of leaders in the field, I helped disseminate inaccurate and misleading information about naturopaths. I looked into the eyes of lawmakers on Capitol Hill and said, naturopathic doctors are masters of prevention. They maintain and restore your health. We take the same courses as medical students and are trained as primary care doctors. Without legislation, we cannot grow to offer our medicine to the wider public. This campaign of misinformation has been successful. About half of the US states license or regulate naturopaths, and 5 Canadian provinces regulate naturopathy. Contrary to what naturopaths will tell you, regulating the naturopathic profession does not make the practice of naturopathy safe. Let me give you a personal example. In 2014, my former boss was importing a dubious cancer medication called Ukraine and giving it to cancer patients. Ukraine is marketed as a cancer cure-all. And with that, it was being given to patients with all types of cancer of all different stages in our practice. Ukraine is not FDA approved, which means that the importation and the administration of it can be considered a federal crime. And Ukraine is associated with some very scary side effects. Now, once I discovered this information, that this drug was being used to treat cancer patients and that it could cause a great deal of harm, I had I guess what you would call a life crisis. I reported my boss to the local naturopathic board. I quit my job. I got a lawyer, and I reported my former boss to the Attorney General. The naturopathic board in the state did do what I would call a superficial investigation. And they ended up delivering my former boss a letter of reprimand, which is basically a slap on the wrist. And the board even twisted the truth in their report of their investigation, saying that my boss had voluntarily stopped using Crane. But the truth is, and he even admitted this to me in private, is that the medication was arriving from overseas. And one day it just stopped showing up. And we thought that perhaps the FDA had confiscated the medication. Looking back, we can now put some pieces of the puzzle together because around the time the manufacturer of Ukraine, this guy, had been arrested in Vienna on fraud charges for relabeling but continuing to sell expired product. And based on the timing of all of these events, it is entirely possible that our patients could have received some of this expired product. And I still feel sick about the whole thing. This experience led me to critically looking at naturopathy in a very uncomfortable way. And ultimately, I decided to leave the profession of naturopathy altogether. It had become glaringly obvious to me that naturopaths are not trained in the rigors of science, medicine, or ethics. They believe homeopathy is real. They think natural is always better. And perhaps most concerning, naturopaths genuinely believe that they are just like medical doctors. This makes naturopaths remarkably bad at providing transparency about their training and education and ensuring safe practices. For example, naturopath Alison Patton recently campaigned for public office in Surrey using the title physician, without clarifying that she is a naturopath, as required by law in British Columbia. The Regulatory College in BC took the complaint against Patton kinda seriously, barring her from practice for 3 days and fining her $500. However, just 1 month later, Patton was under investigation again by the college after advertising natural remedies for the COVID pandemic on Facebook. The therapies included expensive vitamin shots and transfusions of blood treated with ozone gas and UV light. And just to be clear, there is no evidence to support these therapies. Some Canadian naturopaths are still posting information that goes against the expert consensus regarding the seriousness of COVID. For example, this naturopath wrote in a recent blog post that he wants a return to normalcy since COVID is barely a problem for people between the ages of 20 and 40. And earlier this year in March, he wrote that COVID is not more dangerous than the flu, but is causing worldwide caution and hysteria. Regulatory colleges and public health agencies around the world are issuing statements cautioning against the use of natural therapies to treat or prevent COVID, but these warnings seem to fall on deaf ears of some naturopaths. Ontario naturopath posted this Facebook message: if you want to beat the lineups at the assessment centers, acute appointments are available for verifying chronic symptoms that could look like COVID-19. Or skip the worry entirely and bring your child in for an immune boosting visit before they get sick to avoid the symptoms in the first place. Now, to me, as a parent, this sounds like he is suggesting that naturopathic therapies can prevent my child from getting sick with COVID. We know, of course, that this is unproven. But perhaps more naturopaths would be posting publicly about COVID if regulatory bodies in Canada had not made such strong warnings against doing so. For example, this naturopath wrote on Facebook in early October that he feels like naturopaths in Ontario have been essentially gagged from publicly speaking about naturopathic therapies with regard to the immune system and any relation to COVID. I think that this is a good thing. When naturopaths try to communicate science, things can easily get muddied. Here's an example. In June, the US Federal Trade Commission issued dozens of warnings to companies who were making dubious claims about treating the novel coronavirus. Of course, many of these warnings were to naturopaths, offering homeopathic injections to prevent infection, supplements to boost the immune system, and really, really high doses of vitamin C injected directly into the veins of patients. Just days ago, the American Association of Naturopathic Physicians put out a statement recommending that physicians and hospitals give intravenous vitamin C to combat the COVID pandemic. In their statement, the association wrote that recent data from China demonstrated that intravenous vitamin C was an effective adjunct therapy, and that patients receiving intravenous vitamin C experienced shorter hospital stays and lower mortality. So, of course, I looked up this original publication and the data published in March in the Chinese Journal of Infectious Diseases. And I found something very interesting. This study is, in fact, not a study. It is a paper that is putting out recommended clinical guidelines for treating novel coronavirus. I could not find any data to support the vitamin C recommendations. And I literally have no idea where the Naturopathic Association found this so-called published data, if there is any, suggesting that vitamin C could shorten hospitalizations or reduce death. I think it's interesting and worth noting that the authors of this paper also recommended using traditional Chinese therapies to reduce wind. The terrifying aspect of all of this, for me, is that it appears as though the naturopathic profession is willing to use the pandemic to push an agenda to integrate unproven and potentially harmful naturopathic therapies into medical care. More than ever, the naturopathic community has a responsibility to ensure the safety of patients. Instead, I see a profession trying to capitalize on fear. We need comprehensive reform of the naturopathic profession to include stripping them of the doctor and the physician titles, banning them from treating children, and perhaps phasing out licensing altogether so patients stop viewing them as medical professionals. We absolutely should not rely on naturopaths to regulate themselves. One problem is that the public believes that naturopaths are vetted medical providers. They have many markers of legitimacy, accreditation, licensing exams, well-funded organizations. But naturopaths also have their nonsense at the forefront, and they hate it that I point this out to them in writings and talks. Even ahead of this talk, McGill received a letter from a naturopath and McGill alumnus who was upset about my participation in the symposium. I was forwarded an anonymized version of the letter, in which the author wrote, "Ms. Hermes is far from an expert in her field, and instead aids in spreading inaccurate and false, dangerous misinformation about naturopathy. Excuse me. And provides unsubstantiated criticism, excuse me, of the practice of naturopathic medicine, particularly in Canada, via her online speaking engagements and social media accounts." This is nothing new to me. In 2016, naturopaths started a change.org petition accusing me of defamation against the profession, calling me bitter and unsuccessful. It seems the naturopathic profession measures success by the amount of quackery you are willing to sell to patients. And by this standard, I am happy to say I am the most unsuccessful naturopath on the planet. In 2017, I was sued in Germany by an American naturopath for allegations of defamation. It is a long and complicated story. However, the background, the legal arguments, and outcome are all covered in detail on my blog, Naturopathic Diaries. Long story short, we won. The lawsuit was bogus, and the German court ruled my statements were protected speech under the German Constitution. It is important for me to thank Iran Segev from Australian Skeptics, who spearheaded a massive fundraiser to defend myself. And thank you to everyone who donated and sent me messages of support and love. I know that naturopaths were hoping this lawsuit would shut me down, but instead it sparked the Streisand effect. There was global media coverage about the lawsuit, and I think naturopaths ended up getting way more negative press than they bargained for. And in 2018, I was honored with the prestigious John Maddox Award for my work exposing naturopathy. It is clear that naturopaths do not want me writing or speaking about my experiences in the profession. But I will continue to stand up for science and to tell you all to trust me. I am not a doctor. Thank you.
And your giant duck outdoes my little duckies. Wish I could have one of those, but it seems a little bit too big for the office. Let me just remind you that after our next speaker, the three of us will get together for a little chat, and we will rehash some of the stuff that you have heard and offer some more comments. But let us proceed with our second speaker. Brendan Nyhan is a professor of government, and his original background is in political science. He has a PhD from Duke University, also in political science, and now teaches at Dartmouth College. He is a writer. He has written articles in newspapers, in magazines, and of course in scientific journals as well. His basic research is on the science of misinformation and the science of fake news. And I think that we're going to hear a lot of surprising information about what people believe and where they get their information. So let me introduce you to Professor Brendan Nyhan, who will now regale us with the science of misinformation.
So much, Joe. It's great to be here. I want to thank everyone for joining us. It's wonderful to be a part of this event. What I'm going to be doing today is telling you about the research I've conducted with these co-authors listed here on where people get untrustworthy information online to try to understand this problem we've been talking about in different ways. How do people come to believe things that aren't true or claims that aren't supported about the world? That's what I've been studying now for about 15 years in my academic research. And it's become a particularly critical question for lots of reasons that we'll talk about in the present moment. So I'm excited to share our research findings with you and look forward to your questions. So what I want to talk about today is first a kind of narrow question that motivates our research, and then the bigger question that I think underscores why it matters. Okay, so the narrow question is, how much of the information that people are getting is so-called fake news? And that's not a very well-defined term, but let's say information from disreputable sources. People have talked about that a lot as a critical factor in where people are getting misinformation about topics in both health and science and in politics, the domain that I started studying in my research. And so in both of these areas, people have pointed to disreputable online sources that are untrustworthy, that don't use legitimate practices for gathering and verifying information as a key factor in spreading and proliferating misinformation. Which, and there's a lot of reason for concern about those sources, but what my co-authors and I wanted to learn was how much of the information that people are getting is actually from those kinds of sources. Because as we'll talk about, people often infer from these conversations that much of what people are seeing and hearing about these topics, like the 2016 election or vaccines that we'll talk about, is coming from untrustworthy sources. But as we'll show, the behavioral evidence really isn't consistent with that point. So that's really and that leads to the second question here, which is, where are people getting misinformation, right? So this broader question we might think about is not just how much of the information that people are being exposed to is coming from these disreputable online sources, but this broader question of, well, where do people get misinformation? Where do they see it, right? And if we're thinking about what the problem is, if the problem we're worried about is that people are being exposed to misinformation about health and politics and science, well, where are they really getting that, right? And instead of just looking out there in the world and saying, well, there's lots of sources of misinformation out there, we want to actually scientifically try to measure exposure so we can learn about the relative role played by different kinds of sources in creating exposure to misinformation among the public that might have harmful effects on health and science policy, on the political debates we have, on our elections. Okay. And at the biggest level, the reason this all matters is because of this fear that I think a lot of people have had for going on 20 years now, which is that people may be living in echo chambers. This is a hypothesis. This has not been verified. And as I'll explain to you, I actually don't think it's true for most people. But there is a fear, and it is an important one for us to think about, that it's increasingly easy to live in so-called echo chambers. Now, the way this critique has typically been phrased is that people are living in echo chambers of like-minded opinion. So here in the United States, you could watch Fox News if you were a Republican, and you could often get a view of the world that is consistent with your partisan perspective, right? But what we're most worried about is not just an echo chamber of opinion, but an echo chamber of fact, or so-called fact. And that is a very worrisome prospect, because then our media institutions aren't providing any check on our own natural human tendencies to want to believe things that are consistent with our predispositions. It's not just that our opinions are getting reinforced. It might be that we're getting seemingly factual information that is consistent with our predispositions and will lead us astray on issues in health and science or in politics. And that's an incredibly worrisome prospect. As new technology develops, people often are fearful. And I think that's one of the most critical fears of the rise of the internet, and especially social media. So this is a really important question for us to examine right now, as people worry so much about where people get their news and information, particularly here in the US as we approach November's presidential election. Okay, so a useful illustration that we're of course all living through is the COVID-19 pandemic. And here you might think about two different versions of the problem that I've laid out to you, right? So one problem is there are disreputable online sources spreading misinformation, represented here by the so-called Plandemic faux documentary that spread misinformation. That's shown there at the bottom. The other is shown there at the top, which is the President of the United States himself spreading misinformation about innumerable topics, not just in politics, but in health and science, such as here suggesting that wearing a mask actually makes you more likely to catch COVID-19, which is of course nonsense. It's a distortion of a statistic that appeared in a report. But what we want to think about is, well, where are people getting their misinformation? Okay, so there have been a lot of people worried about that second panel there, the pandemic style misinformation that circulates online. And what I'm going to be showing you the results of are studies examining how much exposure people have to that kind of misinformation. And what I'm going to argue to you is that many of the most important sources of misinformation that people are exposed to come via mainstream political figures and outlets, such as the President of the United States here. And the problem, in other words, is not these disreputable internet sources, however worrisome they may be. Donald Trump's platform, when it comes to giving people news and information about COVID-19, vastly outstrips all untrustworthy news sources online that spread misinformation about COVID or vaccines or anything else. When it comes to COVID-19, it's clear that these conflicting claims that are out there are confusing people, and they're expressing concern about them. So some early polling that was conducted during at the very beginning of the pandemic by the Pew Research Center found that lots of people thought they were seeing made up COVID-19 news. Okay, so they were reporting that they had seen what they thought was misinformation about COVID-19. But that doesn't tell us very much. Okay, because when I ask you, tell me about all the news and information you've seen about COVID, of course, that's overwhelming to keep track of. No human being could possibly remember everything they've seen, nor could they know the accuracy of every single article or headline they came into contact with. Okay? And what we're going to do is go beyond this kind of approach of just asking people, have you seen misinformation? And actually behaviorally measuring what kinds of information people are exposed to and characterizing the accuracy or trustworthiness of the sources that they're getting it from. We think that's a much better approach. The panel here on the right indicates that even very early in the pandemic, we were starting to see big differences in who people believed or what people believed about this politicized scientific topic. You can see there at the bottom of the left panel that substantially more Democrats compared to Republicans, even at this very early stage in the pandemic of March 2020, indicated belief that the virus had come about naturally, as opposed to being made in a lab, which was a unverified, unsubstantiated claim that was made early in the pandemic and has continued to circulate. So these differences in what people believe can be quite dramatic. And one of the things we want to understand is how much of that reflects where people are getting their information. The pattern of different experiences in terms of where people get information and then what they believe continues. More recent data here from Pew shows dramatic differences by party, not surprisingly here in the United States, in terms of whether people think the US has done as much as it could have to control the outbreak. So Republicans are much more likely to indicate that's true than Democrats. As you can see in the top panel of the figure, 68% of Republicans say the US has controlled the outbreak as much as it could have, compared to just 11% of Democrats. But what you can see there is even among Republicans, there's a big difference between people who indicate that they rely on President Trump or his COVID-19 task force for most of their COVID-19 news, and Republicans who name another source. So even among Republicans, there's a big differentiation in terms of where people get their information, in terms of how they view the response to the COVID-19 pandemic. And that suggests that these informational differences are important in how people form their beliefs about these politicized science issues like COVID-19. So what I want to start off with is a little bit of a primer on why people might believe in false news or this false information that occur online. Now, there's a lot of reasons. I can't possibly cover them all here. But what I want to highlight to you are two related reasons that I think are especially important for politicized health and science issues, as well as the kinds of political issues that I study in my day job. The first is what's called selective exposure, okay? And that's the scientific name for the tendency that we have to prefer information that is congenial with our predispositions. So when given the choice in an artificial setting, which of these articles would you like to read? People often select the one that's consistent with their preferred party or their preferred stance on an issue. Okay, so there is at least some evidence that people tend to prefer that kind of like-minded information. Okay, and that is, I think, at the root of many of the fears about how the internet may warp people's news and information diets. At the same time, though, behavioral data, like of the sort that I'll be describing to you in a moment, suggests the prevalence of these tendencies is more limited than you might expect. It's really only a subset of Americans. This data is largely in the US, apologies. Anyone who'd like to support equivalent Canadian research should contact me, and I would love to do similar research in the US, but my expectation is the pattern would be similar. It's really only a subset of the population that are devoted to a particular media outlet or set of outlets, and lots of people don't pay very close attention to politics at all. Okay? And so while we all may have this tendency, if given the choice, to select that piece of information that's congenial to us, the average person doesn't invest that much effort in doing so. They often have more balanced information diets, or they don't pay very close attention to politics at all. Okay. Now, once people are making up their mind what they believe on these issues, then the familiar tendencies that you've, I'm sure, heard about, that are often described as being called motivated reasoning, kick in, which is that very human tendency to believe congenial information. Okay? And the fears that we've been describing work in tandem between these two steps. People may seek out and then believe congenial information, and that may be how misinformation moves from its sources, whatever they are, into public opinion. But there too, the story is more complicated. As research has developed in this area, we've found that at least to some extent, corrective information can help change people's beliefs, and people won't just believe anything. So there are limits to what people are willing to believe. There is a kind of constraint imposed by reality, however weak. So that's something to think about. The first case study I'm going to be sharing with you is research looking at exposure to untrustworthy websites during the 2016 election. So as you may recall, immediately after the 2016 presidential election here in the US, there was a kind of panic about the role that these websites play. It became clear that, to an extent, people had not realized at the time exposure to these websites had become far larger than anyone anticipated. They were shared millions of times on Facebook, according to public sharing data. So only the people who had made their sharing information public on Facebook could be analyzed, but even among them, these articles were shared millions of times. What you see here are the 5 most widely shared false news stories according to that public sharing data I described to you earlier from Facebook. And characteristically, they're all negative in that they're, well, I would say 4 or 5 of them are negative in that they're criticizing Hillary Clinton, and all 5 of them are pro-Trump. And that's consistent with the story we saw in 2016, that the composition of the untrustworthy political news people were getting was heavily pro-Trump for reasons we can talk about later if you're interested. What we wanted to do, though, actually, let me hold here for a second. What we wanted to do, though, was get a better sense, not of how many times these articles were shared, but how many people really saw them, okay? And in particular, engage with them in some more meaningful way than just scrolling past them in a newsfeed. It's quite possible for things to disseminate widely on social media, but people may only see an article for 2 or 3 seconds as they scroll by, maybe less. You may not even notice it. If you really think about everything you scroll through on Facebook, it makes you realize, I think it should make you question how much of an effect any given headline might have on you when you really just scroll past it. So what my co-authors and I did instead was we examined, using real world behavior data, how often people visited these websites. So if they got to them from Facebook, they had to click the link and open the article. So these are desktop and laptop views to these sites. Now, people could have gotten there by other means too. I'll talk about that in a moment. But we wanted to see who was visiting these sites and how did they get there, how many of these kinds of sites did they visit, and so forth. So this is, again, behavioral data. So these are people who, with informed consent, allowed for anonymized monitoring of their web browsing behavior. It's a near representative sample of Americans. I can talk more about the details if you're interested. But here's what we found in our published research. So using a broad set of untrustworthy websites that was published in an article in Science the previous year, we found that about 44% of Americans read at least one article from an untrustworthy website, as defined by this list, in fall 2016, in the weeks before the 2016 U.S. presidential election. About the mean number of articles read for a respondent in our data was 14, but they made up a relatively small percentage of people's overall news diets. As you can see, they're only about 6%. If you look at the figures at the bottom, you can see that that pattern of selective exposure I described to you was very much operating. When we distinguished these between untrustworthy websites that we could classify as pro-Clinton or pro-Trump, you can see that Clinton supporters were somewhat more likely than Trump supporters to visit pro-Clinton sites. That's indicated by the triangle points in the left panel. And Trump supporters were much more likely to have visited one or more pages from an untrustworthy website that was pro-Trump. And that's indicated by the filled black circles there in the left panel. So you can see more than 50% of Trump supporters visited at least one page from an untrustworthy pro-Trump website in that period before the 2016 election. But as I've tried to emphasize to you, people see a lot of news and information. Just seeing one of these pages once may not have much of an effect. We might want to think about repeated exposure. That might be a context where we think claims of influence are more plausible. And so what we did was we looked at the percentage of people's news diets that came from these untrustworthy sites. So we had a quite comprehensive list of the top 500 sites about hard news topics compiled by Facebook researchers. And we looked at what percent of visits to these sites about focus on hard news topics or these untrustworthy websites, the untrustworthy websites made up. So that's what you're seeing in the right panel. And there you can see that these untrustworthy websites made up a negligible fraction. That's indicated by the heavy points. The little dots indicate different individual respondents, but the heavy points indicate the mean for the sample. And you can see that for Clinton supporters, regardless of the type of website we're talking about, and for pro-Clinton news, untrustworthy news among Trump supporters, the fraction was negligible. It was really only for Trump supporters with pro-Trump untrustworthy sites that we saw them making up anything more than a negligible fraction of people's information diets. And there we see a number more in the 10 to 15% range. So not trivial, but not 50%, not 75%, still a relatively small proportion of all news and information that they were getting at this key time when people might have been making up their mind or getting ready, deciding whether to vote or not. But as I told you, our claim and expectation from prior research is that echo chambers are really not a mainstream phenomenon in the sense that every person does them. It's really a subset of the population that does them, that may be in them rather. And so what we did was we disaggregated the population of Americans by the overall slant of their news diet, from the 10% of Americans with the most conservative news diet, which is indicated with the 10 there on those graphs you see, to the 10% of Americans with the most liberal news diet, which is indicated by the 1 there. So the 1 on the left for the most liberal, 10 on the right for most conservative. Okay. And then we looked at exposure to these sites. And just like in the figures you saw before, the left panel is measuring, did they go to at least 1 page from these sites? And the right is measuring how much of their news diet did it represent. Okay. On the left, you can see a similar pattern to what we saw before, but now even more precisely, as you move to the left, Americans were more likely to have visited a pro-Clinton site. So as you have people who have more liberal information diets are more likely to have visited a pro-Clinton untrustworthy site. The same pattern appears most dramatically in those last 2 deciles of on the right. So the 20% of Americans with the most conservative news and information diets, right? More than 50% in that 9th decile, more than 75% in that 10th decile visited at least 1 page from one of these untrustworthy sites. And if you move to the right panel, which is thinking about what proportion of people's news diets these sites represent, there the story becomes even clearer. You can see that across the board, as we move from left to right, these untrustworthy sites make up negligible fractions of people's news and information diets until you get to the last 3, and particularly the last 2 deciles, the 20% of Americans, the most conservative news diets overall. You can see there, 20 to 25% of their news and information was coming from these untrustworthy sites. So the consumption of these sites was really concentrated in that segment of the population. We found that approximately 6 in 10 of all exposures to these untrustworthy sites came from that 20% of the population. How did people get to these sites? We looked immediately before and after exposure to see what happened. So what I'm going to show you here is immediately before exposure, what sites were people visiting? So we look at this for untrustworthy news sites, as well as these sites focused on hard news topics and sites that don't fall into either category. And what you can see there on the left is that Facebook stands out. In the 30 seconds prior to someone visiting one of these untrustworthy sites, approximately 15% of people had just loaded facebook.com into their browser. Okay, and if you expand that window from 30 seconds, if you go to 45 seconds, 60 seconds, et cetera, that number will only grow. So we think that data suggests the role played by Facebook in particular in driving people to these sites. Now, the second case study I'd like to share with you is new research that is even closer to the focus of this symposium, and that's research on misinformation about vaccines. It's important to be clear, as we talked about with politics, that misinformation did not start with the internet. So I have here on the left the infamous retracted article by Andrew Wakefield and his co-authors. This was a fraudulent piece of research that was shamefully published in one of the world's most important medical journals, The Lancet, claiming that the measles, mumps, and rubella vaccine, the MMR vaccine, could give children autism. Is incredibly damaging, had a real effect on public health, especially in the UK, but had ripples around the world. That misinformation, of course, sadly spread largely on its own and not through the internet. The internet was in a very early form in 1998. A lot of what drove the effects in the UK, for instance, seems to have been mainstream news coverage. Here in the present day, however, as you can see on the right, we often worry about misinformation and how it spreads through sources like social media. So you can see there examples of the kinds of anti-vaccine groups which often try to use Facebook and other social media platforms to reach people. And often what they're promoting to them is misinformation about the safety and efficacy of vaccines, whether it's Wakefield-style claims or other claims that aren't well supported by valid scientific research. So in both cases, this misinformation is out there, but it's taking this potentially worrisome new form. There's been a lot of research counting how many anti-vaccine websites are there if you do a search for vaccine on Google or on Facebook. But what we don't know, again, very similar to what I described to you earlier, is who actually sees these, right? To what extent are they reaching people who may be likely to change their mind? Or to what extent are they being consumed largely by people who already have anti-vaccine predispositions in the manner we saw when we looked at the political data I showed you earlier. So my co-authors and I went through a very similar process to what you just saw. We looked at behavioral data from a large sample of Americans who had opted in to provide informed consent to share this anonymized browsing behavior. But now we're looking at a collection of these samples, not just that 2016 one that I shared with you earlier, but a number of them between 2016 and 2019. So we have a much larger sample. And what we did was we took every URL they visited, extracted the text, these are of course public, extracted the text and isolated those that mentioned vaccine or its derivatives, VACC, that stem, or sort of 3 or more times to indicate this is a page that is focusing on vaccine-related topics. And then we had coders go through and code whether that web page was skeptical about the safety and efficacy of vaccines or not. And what we found, I think, was pretty striking and contradicts a lot of conventional wisdom that's out there. First, people don't consume a lot of online information about vaccines in general. When you convert our numbers to an annualized rate, you do find that 84% of people visit at least one web page related to vaccines per year, but the number of pages they visit is pretty low. And in particular, we found that fewer than 1 in 5 Americans would be expected to visit a web page we would classify as vaccine skeptical every year using this annualized rate approach. And even those, so that's just a binary measure, how many do they visit per year? When it comes to the share of the vaccine-related information they're consuming, the share that's made up by vaccine skeptical web pages is quite low. You can see they're 7.5%. So most of the overwhelming majority of the information that people are encountering is not from vaccine skeptical sources. These are ones that we classify as not skeptical. Okay, so the kinds of sources you might worry about that are campaigning against the safety and efficacy of vaccines seem to be a relatively small proportion of all the news and information Americans consume. Now, important caveat, we can't see into Facebook. So it's, of course, possible something different is happening there. But when we verified this against known anti-vaccine Facebook groups, we found that visiting any of those was extraordinarily rare in our sample as well. We only found one person who did so. The final note is consistent with what you might expect. The non-skeptical web pages were more likely to come from .edu and .gov domains, which is an indication of credibility. And conversely, more than 1 in 5 of the web pages we found people visiting that we classified as vaccine skeptical had been identified as untrustworthy using that same list I was describing to you earlier. Now, again, we were interested in selective exposure. Were people seeking out vaccine-related news and information that was consistent with their point of view? And so what we did is, for a subset of our sample for whom we had a measure of vaccine attitudes, we classified them based on their this prior measure of vaccine attitudes into 3 terciles, so approximately 1/3 of the US population. The third with the least favorable views towards vaccines, the third in the middle, and the third with the most favorable views towards vaccines. Importantly, to be clear, Americans tend to have positive views towards vaccines. So on average, that least favorable tercile is about in the middle of a 5-point scale of favorability, and that most favorable tercile is way up towards the top. So this is kind of on the favorable side of the scale, but again, we're dividing the population based on their relative favorability. So from least favorable to most. And what you can see there, consistent with what you saw before, is first that vaccine skeptical webpage exposure was quite rare. But second, interestingly, there was no evidence of selective exposure on the vaccine skeptical web pages, where exposure rates were low and relatively flat, regardless of what vaccine attitude group you were in. Where we saw potential selective exposure instead was on how much non-skeptical vaccine information people were exposed to. And there you can see an increase as you move from the least to the most favorable group in terms of binary exposure. Did they ever visit a non-skeptical vaccine-related page? And then mean number of pages, right? As you go from least to most favorable, same pattern. The most favorable are consuming the most non-skeptical content. We found a similar pattern with some nuance here on Facebook. Okay, so we were interested in the role of Facebook based on those results we showed to you earlier. And we found that Facebook usage was associated with greater consumption of both of these kinds of content, both non-skeptical vaccine information and skeptical vaccine information. And so we saw this upward trend for both. It's most dramatic when it comes to the non-skeptical information, but you can see that exposure to vaccine skeptical information is also increasing there for as Facebook use increases for both whether you visited one of these pages and for how many of these pages you visited on average. And then finally, we looked at how people were getting to these pages. And so following the approach I described to you earlier, we're looking at the 30 seconds prior to exposure in the left panel. And we wanted to see how often were people going to vaccine-related content immediately after loading Facebook, Google, or a webmail provider in their browser. And I would say the clearest result is that Google use was associated with exposure to non-skeptical information, differentially so relative to skeptical information. That's what you can see in the middle set of bars in the left panel. So there seems to be an indication, at least, that Google is surfacing non-skeptical information about vaccines. The patterns after exposure are somewhat less clear. And I just want to kind of emphasize one last point as I bring this to a close, and that is that this finding that for broader measures of political news, like the one I showed you, the study I showed you for the 2016 election, the finding that it was really a small percentage of people who are consuming a lot of this untrustworthy news and information is consistent with other evidence. So this is a study of who shares and is exposed to untrustworthy news on Twitter. These authors found that the top 1% of sharers on Twitter shared 82% of all of the shares of fake news or false news on the platform in the time they were studying. And similarly, the top 1% of consumers were responsible for 74% of the exposures to those false news stories. So these tend to be highly skewed phenomena. And I think that has really important implications for our understanding of these problems. We can see this information is out there. It's very worrisome. It spreads among these relatively small populations. And we infer from that everyone's seeing it. But that's not necessarily the case. So what I want to conclude by emphasizing is that there's strong evidence of selective exposure to false news, as I showed you, and maybe to some lesser extent for vaccine information. But the overall exposure rates are pretty low, especially as a proportion of people's information diets. And what that suggests is when we're thinking about the sources of misinformation that people are being exposed to, whether it's about science or about politics, we should start with the mainstream sources and figures who get the most attention, who make up, who drive the news agenda, who are at the center of so many of the controversies that traffic at the top of the social media charts. Those are the places that are most important. And what that underscores in the context of something like COVID-19 is that misinformation from, say, in the United States, from the White House and the president, is far more worrisome than misinformation from obscure websites and sources, and has a potential to do much greater harm. So I'll stop there. Thanks.
Discussion with our two speakers, and we also have, I think, a couple of questions that have been texted in. Let me first start with Britt. Is there any redeeming value to naturopathy? I know that sometimes we get into discussions about naturopaths kind of being living placebos, which might be appropriate if someone has gone through all of the medical establishment and there's been no answer to their problem, and they go to a naturopath who will kind of soothe their soul. So, I mean, is there anything positive that can come out of it?
Well, I want to first start by emphasizing that by and large, naturopaths are good people. I think naturopaths enter the field with good intentions and with their hearts in the right place. And I really believe that most naturopaths like me are sort of duped by the system into thinking that they are more qualified than they really are. And since it is a profession that tends to attract nice people, naturopaths listen to patients. They have really good bedside manner, and that can leave the patient with a really kind of warm feeling of feeling heard. I know for me, that was really pivotal in what drew me to naturopathy. But even though naturopaths are good people, this doesn't mean that they are good doctors or good physicians or even a good choice for healthcare. So I like to draw a hard line in the sand and to make sure that anyone who is considering naturopathy as a healthcare choice truly understands that naturopaths are not trained as doctors. They are trained in a system that operates outside of, and purposefully so, outside of the medical system. And if they go into a situation fully knowing that, fully informed, then so be it. But my stance has always been to make sure that the patient has all of the information up front.
You worked as a naturopath for what, 3 or 4 years?
Yeah.
And finally, I mean, you made the change because of this bogus cancer treatment. But in the 3 or 4 years that you were working, I mean, didn't you see that maybe what you were suggesting to people wasn't helping?
Yeah, sure. But I suffered from motivated reasoning and a lot of cognitive dissonance. And so it wasn't actually enough that the patients I was treating weren't getting better. Instead, it was the patient's fault for not following the naturopathic advice to the T, and perhaps some other barrier to health. And so naturopaths are not just trained in pseudoscience, they're also really well trained in blaming the patient for their own sickness. And so this involves a lot of things like, oh, you're not drinking filtered water, you're not eating organic, you have a stressful job, well, then of course you're sick. How could you possibly be healthy when you don't have the so-called basic tenets of health in alignment in your life? And so it was always really easy to come up with a justification for why my special naturopathic therapies weren't working. And mind you, I spent 4 years in this postgraduate program, tens of thousands of dollars, and all of this postgraduate training. So it was not a position that I was going to abandon readily. I was happy to find fault in the patient or somewhere else and not with naturopathy itself.
Okay, let me get to Brendan. Your research was based on social media. Where does television fit into this? Because we have this battle between CNN and Fox News. So what what do you make of the sort of a percentage of the population that gets their information from there?
It's a great question. I think we're still trying to pin that down. The average rating on cable news is a lot smaller here in the US than you might think from the role it plays in our political conversation. One reason is it's a kind of, especially Fox, a kind of pipeline into the Republican base. So even if it's not reaching tens of millions of people, it's reaching an especially influential and active group that politicians cater to. I think, though, it's worth thinking about why Fox in particular seems to have had big effects. So the story of this field, just to kind of bring people up to speed, is when television was first introduced, there was a real panic. This was like mind control, mass propaganda machine. And TV does have political effects, but I would say they're more subtle and nuanced than people expected early. And there was a kind of decline in the focus on the effects of TV. Fox, though, delivered a really different kind of programming than people had received via television here in the United States. And research began to show that when Fox appeared on a cable system, there was a shift towards Republicans that in actually vote shares. And then there were indications that it started to affect legislator behavior via those voters or some direct mechanism. And even now, people are looking at the relationship between watching Fox and various opinions or behaviors related to the pandemic. So I think we shouldn't underestimate the role of TV. Everyone's very focused on social media because it's new. But if you think about the age distribution in the United States, we have a lot of old people. I think Canada does too. And of course, if you think about older people in their life, many of them are watching a lot more TV than they are taking in information via Facebook, although that's started to change.
I must say, I watch CNN, and occasionally I take a look at Fox too. And there's no question that CNN, of course, has an anti-Trump bent. But I've never found anything on CNN that is scientifically incorrect. They may cherry pick some information. But on the other hand, when you look at Fox, almost everything that they have relative to COVID is scientifically incorrect. So it's not just a question of sort of a Democrat view against the Republican view on the two TV channels. It's much deeper in terms of thinking about whom do you trust, because one is much more factual than the other.
Yeah, and the average person can't sort that out, right? They don't have the background knowledge that you do, Joe, to be able to look at this and say, well, I know the scientific research they're referring to, and that's a mischaracterization of it, or that contradicts the expert consensus. I think that problem is particularly profound in the kind of morning and evening parts of Fox, which are heavily opinion and entertainment oriented, but still have the Fox News brand and are still, the hosts of them are still suggesting they're delivering news and information. In the middle, there's this increasingly squeezed set of real journalists at Fox who deliver things that play by normal journalistic standards, but that's a kind of shrinking group. And in the meantime, the claim that everything you're getting there is unbiased news is still taking place. Obviously, Fox isn't the only source of misinformation, nor is this a problem confined to the right, but Fox has been a real innovator in the way it blurs those distinctions between news and opinion. And by the way, it goes beyond just what you might think of as differences in media slant to actively incorporating misinformation into opinion content in a way that's hard for people to pick up.
Britt, you obviously have had all kinds of interactions with former fellow naturopaths and current ones. And what is your feeling about what percentage of the practicing naturopaths may actually question some of the stuff that they are doing?
I think it depends on how long that naturopath has been in practice. So I would suspect that the early graduates are perhaps a bit more naive, like I was when I was an early graduate, and really hanging on every word of these magical treatment stories and homeopathy curing poisonous snake bites and and whatnot. And I think as naturopaths spend more time in practice, they come to realize that the things that they consider to be naturopathic really aren't so useful. And what is useful is just listening to patients and sort of providing a consoling ear. And that is not naturopathy. That's just being a decent person, or perhaps a counselor, and perhaps providing, a little bit of psychological counseling. And so I think in the end, what really works and what naturopaths tend to come around to is that it's not naturopathy, but the stuff that is basic and all good old-fashioned primary care medicine.
You've, of course, been attacked by the naturopathic profession in general, and individual naturopaths too. Now, a lot of this, of course, comes from the fact that you're kind of, biting into their livelihood.
Yeah.
So it's kind of to be expected that they're going to fight because you're kind of taking money out of their pockets, right? Have you had support also from others in the naturopathic community? Do you know of any others who have kind of taken your route?
Oh, sure. Just this week, I received 2 emails from 2 McGill alumni who went on to pursue naturopathic and alternative medicine careers and had left naturopathy and wrote to me thanking me for my blog and my writings, because in the midst of their own sort of life crisis and trying to figure out if naturopathy was real or not, they found my blog, and it helped provide them with a different perspective from everything else you're hearing inside of the naturopathic echo chamber. So there are certainly many examples. However, the attacks that have come to me make these naturopaths a little weary of speaking publicly and certainly being as vocal as I have been about what they came to sort of realize on their own, which is that they are not being trained in the same kind of medicine as doctors, right, and things aren't as they wish they were.
In your experience, what would be the proportion of patients who come to a naturopath as a primary care physician, as opposed to those who come out of desperation after the conventional medical community has failed them?
Yeah, so in my experience, this really depends on where you're practicing. So in a state like Washington, or in a province that regulates naturopathy in a way that allows that naturopath to call him or herself a primary care doctor, you're going to attract a patient base that is pursuing primary care medicine. And in the states that are less well regulated, or perhaps the rules are a little more wish-washy, you tend to have the patients seeking naturopathy out of desperation. So it tends to have pockets, I would say.
Okay, Brendan, let me switch to you, because you've also written stuff that's controversial. Have you had any personal attacks?
Nothing as dramatic as Britt. I'm afraid I can't come close to that. The Wall Street Journal editorial page attacked me early in President Trump's term as a hysterical critic of democratic erosion. And I'm pretty comfortable with that stance 3 years later, given the direction the US has taken. But yeah, actually, I write about vaccine misinformation too. And I've been actually struck by, knock on wood, how little pushback I've gotten. I think Britt's story is really important, though, for a couple of reasons that I hope people take away from this. I just want to maybe underscore the connections to my own work. One is, I think people like Britt are really credible messengers. It's very hard to accuse her of being some tool of big medicine or whatever when she paid thousands of dollars and devoted her life to this cause. And I think these people who've changed their minds on something like this can be very powerful messengers. There's some evidence on this for the GMO issue. And I think it's important actually to test for the vaccine issue too. One of the strategies that pro-vaccine groups have used is actually, it's tragic, but to parents speaking out whose child died because of a vaccine preventable disease. We're seeing similar approaches tragically again with COVID. People saying, I didn't believe this was real until it happened to me. I think that those kinds of credible messengers can be really powerful. So I just want to kind of underscore how that element of Britt's story can resonate for when you think about why people might change their minds on these issues. One of the first things they do is they think about, do I trust this person? Is this person credible to me? And someone who used to believe in something and who, you know, seems to come from a similar background or share a similar set of values can be a really powerful advocate. So, you know, I think there's a lot there that we can take away from this. And, you know, I think it's wonderful she's sharing her story. And, you know, I hope to not go through the same dramatic, maybe I'll come back in 20 years and tell you that political science was a fraud, but I don't think so. So we'll see.
You deal with the myth versus fact all the time. Now, what about QAnon? How can there be so many people who believe the totally unbelievable?
QAnon is remarkable. You know, I think that's a good example of something that's really a tiny percentage of people who believe in it, but it's quite visible. So actually, I think the framework I've given you is a really valuable one when you think about QAnon, which is to say, this is something where the consumption is concentrated in a small, passionate minority that consumes a lot of it. So I don't think QAnon is a mass phenomenon in the sense that tens or hundreds of millions of Americans will believe it, at least I hope. But it is the case that it's gotten traction in a way that no one anticipated. And it's particularly worrisome for two reasons. First, that it's inspired some people to commit direct harms already and has been identified as a domestic terrorist threat by the FBI here in the United States. And second, that it's starting to influence the Republican Party here in the United States, and through that mechanism, potentially influencing public policy here. We'll almost surely have a member of Congress in January of 2021 who's an adherent of QAnon, and many other Republican politicians are now dog whistling to them or worse in terms of the kinds of appeals that they're making. So I'm shocked at how easily it's been mainstreamed in that sense. I think it seems to have the elements of some of the conspiracy theories that have gained traction over the years. And actually, in that way, it's a great reminder that the problems we're describing go back decades and even centuries, that we've often had these conspiracy theories that take hold, that tell people that the world is being run by this malevolent network that is scheming behind the scenes. We've had those conspiracy theories rise and fall over the years, the Masons and the Trilateral Commission and the New World Order and all the rest. QAnon, though, is really optimized for the internet and the partisan politics of the US in an important way, right? It has this gamification element that people use the internet to try to figure out the clues in a way that draws people in and has this participatory action that builds community and causes people to become invested in it. And then second, the network that it claims runs the world is explicitly partisan. And I think that's especially dangerous because now it's linking that conspiracy in a much tighter way to one party. Many of the conspiracy theories I described before didn't suggest that it was one party. The conspiracy, of course, controlled both parties if you believe in that kind of conspiracy. This one is saying it's one party that's conspiring to harm children and do the most awful things. And it seems to be filling some kind of a void that people have in terms of their belief system or their ways of finding meaning. And again, I think it's really terrifying. And actually, one thing I would ask you, Joe, I wonder, what traction it's gotten in Canada, because it has started to spread around the world, despite starting supposedly as this fake government insider here in the United States. We're starting to see it in Germany and Australia and other places.
We're seeing it here because we've had some anti-mask demonstrations, and they carried the QAnon placards and flags. Yeah, so we're seeing it. Anyway, let me ask both of you one final question. Very straightforward one. Whom do you trust? Brendan.
So people always ask me who is like the source I should trust. And actually what I want to suggest is that's not the right way to think about the problem. I trust information that's been verified by multiple sources that use legitimate measures to create knowledge, whether that's in journalism or science or other knowledge producing institutions, right? Journalism is always provisional. Science is always provisional. Sometimes the answers change. We've lived through that on COVID, but I trust those answers that have been through that process of being verified and assessed by multiple, multiple people, multiple sources. And in that way, I think scientific and journalistic consensus can be powerful, even if every study and every article is itself imperfect, and its findings may change.
Britt?
That was a good answer. I can tell you who I don't trust. I can tell you that I don't look to my gut instinct anymore as a source of trusting, is this the right decision or is this not? What feels good or smells good or looks good or sounds good isn't a sign that that is right or that's a trustworthy source of information. And so I've had to unlearn years of information and really go back to the very, very, very beginning and to think about, who can I trust? I mean, I remember walking through the grocery store after leaving naturopathy and being literally at a loss of how to buy food anymore, because everything that I knew was wrong. Was organic good? Was organic bad? Did I have to eat quinoa? I don't even know anymore. And so what I do is I look for the consensus. And I remind myself that if something is on the fringe or a minority opinion, that there's probably a good reason that that is sitting off to the side. And even if that piece of information is hitting something emotionally inside me, that I need to take a step back, take a breather, and look at what the consensus opinion is on that subject matter. And I force myself to read that information and to go towards that information until I can start to understand what's really happening.
So are you eating bratwurst and sauerkraut? Because
oh my God, sauerkraut is my favorite. It's always been my favorite. Yes, is the answer.
Okay, well, thanks both of you for illuminating discussion and for your talk. And I think we've given people some idea about who is trustworthy and who is not, and how one should look at information and unravel its mysteries. And we will carry on next Monday with 2 more speakers. Anthony Werner is a chef in England. He will be joining us. And he has written a phenomenal book called The Angry Chef. And you'll find out why he is angry. And we will also be joined by Wendy Zuckerman, who hosts a podcast called Science Versus. And you may want to check in on that before next week. And I think that you will be very entertained by the great scientific information that is presented on that website. So a week from today, again at noon, with Anthony Werner from England and Wendy Zuckerman from New York, although she's originally Australian. You'll love her accent. And we're going to have a very good time demystifying some more science for you guys and putting you on the track where you may find out who is trustworthy and who is not. So thanks very much for joining us. I'm Joe Schwartz. I hope that all the chemistry in your life comes out just right.